Generalized anxiety disorder, or GAD for short, is a mental health condition characterized by prolonged and excessive anxiety about everyday situations, such as finances, relationships, or day-to-day tasks. This anxiety is often out of proportion to the actual situation and can cause significant distress in daily functioning. Imagine you have a big presentation coming up at school. You've been preparing for days, your slides look amazing, and you've practiced your delivery more times than you can count. But when you finally stand in front of the class to speak, your brain's fear circuit suddenly kicks in.
Enjoying our Osmosis videos? Unlock your full potential with an Osmosis subscription. Get unlimited access to every Osmosis feature and resource with a free 7-day trial.
The amygdala, which is an almond-shaped structure buried deep in the temporal lobe, recognizes this situation as a potential threat and sends excitatory signals to the hypothalamus. The hypothalamus then activates the sympathetic nervous system, setting off a chain of reactions in the body, including a fast heartbeat, rapid breathing, sweating, muscle tension, and a dry mouth. Meanwhile, the locus ceruleus in the brainstem releases norepinephrine, which floods the amygdala, activating beta-adrenergic receptors and pushing it into a state of hyperarousal. Additionally, adrenal glands start pumping out corticosteroids, which are stress hormones that can increase activity in fear-related circuits, making you more sensitive to stressful situations. All these changes represent a typical anxiety response. It's uncomfortable but temporary and appropriate to the situation. Once it's all over and the room fills with applause, that wave of anxiety finally starts to fade. Your brain begins to wind down, and this is when the ventromedial prefrontal cortex comes into play. This part of the cortex directly inhibits the amygdala using the inhibitory neurotransmitter called GABA, quieting its activity and calming the anxiety response. At the same time, the ventromedial prefrontal cortex stimulates the raphe nuclei to release serotonin, which helps indirectly calm the amygdala even further. Another key player in the fear circuit is the hippocampus. It helps your brain figure out whether a situation is actually dangerous or just feels that way because of something you've experienced before. Now, in generalized anxiety disorder, the usual brake system between the ventromedial prefrontal cortex and the amygdala isn't working properly. There's not enough GABA and serotonin to keep the amygdala calm, while the locus ceruleus is working overtime and flooding the amygdala with norepinephrine. This pushes the amygdala into a constant state of high alert, keeping a person stuck in a state of excessive and disproportionate anxiety, fear, or worry. On top of that, when stress sticks around for too long, the body keeps pumping out corticosteroids, which can, over time, cause atrophy of the hippocampus and further impair the ability to manage stress. Now, certain risk factors can make someone more likely to develop generalized anxiety disorder. Big life stressors like losing a job, going through a breakup, or dealing with financial trouble can tip things over. Feeling alone or like there's no one to lean on, even if support is technically there, can also make things worse. And if someone went through a tough childhood, like witnessing violence or dealing with neglect, that early stress can leave lasting marks on how the brain handles fear and anxiety later in life. Switching gears and moving on to symptoms, which fall into two main groups. Psychological symptoms happen because the amygdala is working overtime. These include persistent, excessive, and unrealistic worry about everyday situations. For example, a medical student with generalized anxiety disorder might constantly fear failing all their classes, despite consistently attending lectures and performing well on exams. They might become hypervigilant, trying to memorize every line in a textbook out of fear of failing the exam. Sometimes this worry causes them to avoid anxiety-provoking situations entirely. For example, they'll refuse to take an exam due to an overwhelming fear of failure. Other common symptoms include fear, agitation, impatience, and impaired concentration. Next, individuals with generalized anxiety disorder often ask the same questions to seek reassurance and ease their anxiety. Some might develop specific phobias, such as a fear of being far from home or a fear of social interactions. Sleep disturbance is also common because individuals stay in bed at night imagining worst-case scenarios or worrying about what might happen in the future. Next up are physical symptoms caused by an overactive sympathetic nervous system. These can include restlessness, muscle aches, and extreme fatigue, along with sweating and cold or clammy hands. Some people may complain of dry mouth, while others might describe a lump in the throat or a choking sensation. Others experience a racing heartbeat or breathe too fast, which is known as hyperventilation. Finally, digestive issues are also common and may include nausea, vomiting, diarrhea, or an upset stomach. Now, to diagnose generalized anxiety disorder, a person must experience uncontrollable, excessive anxiety and worry across multiple areas of life on most days of the week for at least 6 months. Additionally, the anxiety must follow at least 3 of the following symptoms: restlessness, fatigue, impaired concentration, muscle tension, or sleep disturbances. Finally, always rule out conditions that can mimic anxiety, such as thyroid dysfunction, substance intoxication or withdrawal, hypoxia, and metabolic abnormalities. Next up is treatment, which typically starts with psychotherapy, including cognitive behavioral therapy and mindfulness-based stress reduction. In more severe cases, a person might require medications, with selective serotonin reuptake inhibitors as the first-line option. These medications work by blocking the reuptake of serotonin into neurons, thereby increasing its levels in the brain and calming the amygdala over time. For cases of severe functional impairment, benzodiazepines can quickly relieve symptoms by enhancing the effects of GABA. However, they are only a short-term solution, since long-term use can lead to dependence. Alright, as a quick recap. In generalized anxiety disorder, the usual brake system between the ventromedial prefrontal cortex and the amygdala isn't working, leaving the amygdala in a constant state of high alert. This leads to chronic psychological symptoms, including excessive and persistent anxiety, fear, or worry that affects many areas of life. Often, this worry is out of proportion to the actual situation and causes significant distress in everyday activities. At the same time, physical symptoms develop due to an overactive sympathetic nervous system, such as restlessness, muscle aches, and extreme fatigue.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more